Writing audiological reports for children. You should get their name, their address, their date of birth, pre-birth history, medications used during pregnancy, pregnancy length, and if there were drugs or alcohol used, the birth weight, the age, C-section, conditions at birth, jaundice, anoxia complications, use of an incubator. All of this might help you put together a full picture of the type of hearing loss the child has, if it's sensory, neural, or conductive, mixed, the origin of it. Some good questions to ask: is there a speech delay? Is the motor development normal? Any seizures, illnesses, accidents, history of hearing loss in the family, history of ear infections? The number one reason children see audiologists is to rule out hearing loss as a cause of language delay. Have there been any surgeries, medications? How is the child at home? Are the parents around? Are there other siblings that do the talking for the child? How many languages are spoken at home? That might be a cause of the language delay. Or are older siblings doing the talking for the younger child? Does the child use gestures to communicate their message? All of that helps you put together a full picture before you even start your pediatric evaluation. With adults, again, you also want to take a thorough medical history of disease, primary complaint, does the ear hurt? Are there any previous hearing evaluations? Where were they? Hearing loss, the audiogram should track rather similarly year from year. You see minor changes, but it should follow the same form. Is there a history of hearing loss in what year? Are there ear infections? With the adult history, was there ear surgery, tinnitus, that's ear ringing, in which ear, at what intensity, noise exposure, what does the person do for a living? Might that have led to a noise-induced hearing loss? Vertigo, dizziness, is there Meniere's disease to consider? Are there any other illnesses? What current medications is the person on? Is the person taking any ototoxic medications or medications which be toxic to the ear? Does the person use hearing aids? Do they use 2 hearing aids or just 1? 2 hearing aids are always better. For report writing, the first paragraph is identifying the patient. The second paragraph is a statement of the degree, the severity, the type of the hearing loss, the tympanograms. Are there acoustic reflex present? The third paragraph is recommendations such as hearing aids, speech and language therapy, avoiding noise exposure, and returning for follow-up. You may need to refer to other specialists. A proper report should be as thorough as possible. Patients need to sign a release saying that you can let out their information. When you are writing your audiograms, you avoid verbosity, well-written, proofread. So I love simplistic writing, straight and to the point. That's how you write an audiology report. No flowery language. Audiologists work very closely with otolaryngologists. So audiologists provide the non-medical treatment of hearing loss. They can't write prescriptions for medical treatment or perform surgery. They work very closely with otolaryngologists. So otolaryngologists are medical doctors specializing in the ear, nose, and throat. Often otolaryngologists will have audiologists in their office and they work together. Remember, audiologists are the hearing experts, otolaryngologists are the medical doctors. So when you're referring to an otolaryngologist, you want to state your area of concern in the report. You don't make any recommendations for specific medical treatment, but you might want to schedule a patient if there's a disorder that can be treated by the otolaryngologist. Sometimes you might refer to a clinical psychologist if the patient's problem is at least partially complicated by an emotional disorder. State your particular concerns and your reasons for referral. Psychologists can provide information regarding a patient's performance versus their potential. So you're not a trained psychologist. If you're concerned about a person's mental state or emotions, make sure that you refer. Genetic counselors. Genetic counselors provide medical and genetic information. They help to support family members as they learn how to deal with a child's hearing loss. Failure to recommend a family for genetic counseling could lead to legal trouble. So genetic counselors can give the parents an idea about the etiology or the prognosis of their child's hearing loss, and they may be able to provide the probability of having another child with hearing loss. So the audiologist should ensure that the family knows that genetic counseling is available. Audiologists work very closely with speech-language pathologists. We have had similar coursework with speech-language pathologists. And audiologists often see patients because SLPs wish to know if a communication disorder is related to a hearing loss. So you should collaborate with your SLPs to put together proper planning and remediation of a child or adult with hearing loss. With your SLPs, again, write frank and direct reports, opinions regarding the type and the extent of hearing loss, recommendations for referrals to other specialists. You can state your opinions regarding the effects of hearing loss on the patient, but avoid specific recommendations regarding therapy. That's the speech-language pathologist's realm of practice. And you could recommend follow-up audiological testing. There are also teachers of children with hearing loss. So if a person works in a school with hearing loss children, these teachers, their primary responsibility is to teach math, English, social studies, and all those other subjects that a child needs to learn. But they have a background in hearing loss, so they know how to work with children that have hearing loss. So you might work with these teachers, and the teachers, you would speak to them about their hearing aids, the classroom amplification systems, if they have FM systems, and good classroom acoustics. Also, you have to speak and work with regular school teachers. So with PL 94-142, a lot of children with hearing loss are now in regular classrooms. And these teachers might have no background in working with children with hearing loss. And in addition to their child with hearing loss, they have, 24 or 25 other children with their own needs. So you need to provide information to these teachers about how to best help this child with hearing loss. The impact of background and classroom noise, the resultant fatigue from attempts to visually compensate for the hearing loss, that high-frequency sounds could still be missed even with amplification, and specific classroom management techniques for children with hearing loss. So you're the liaison for those children with hearing loss.